Hello, viewers. Welcome to another episode of The Cure for Your HIV. I remain your delightsome M Square. Of course, I care about the lifestyle of people, especially people living with HIV and AIDS, and I am a public health worker. I work to support change so that people can have the knowledge to make informed choices and take control of their sexual health and general healthy lifestyle. Okay, so if you are looking for testing, you want to know about your status and you want to know how to go about it, or if you want to know more about sexually transmitted infections and preventions, or maybe you'd like to know some honest advice on sex and relationship, okay, marriage, you have a couple or a partner who is positive and you're negative and you're worried. How should you go about the wedding or not? What will be the status of your children if you should go ahead to get married? You would find all of these answers right here in this channel. So kindly subscribe to my YouTube channel, click on the notification bell so as to get updates when next we are releasing another episode for the cure for HIV. Alright, so very quickly today we are going to be talking about very important topic, and it is very essential for you to stay tuned so as not to be left out or not to miss out. Okay, we've talked about what HIV and AIDS is, we've talked about what AIDS is, we've talked about the stages of this HIV and AIDS infection, but today we want to talk about the opportunistic infection and how they affect the various parts of the human body. And here is a picture showing various types of opportunistic infections that affect parts of this body. For example, we have the eyes, we have the tongue, the mouth also, we have the penis, the sore on the penis, we have the vagina discharge and the sore there, we have the warts, we have the skin disease, and so on and so forth. So today we are going to be talking about how they get into your body once your immunity is low. What do they do to the body system? Okay, so I'm going to be talking about the various parts of the body, like I said, with these opportunistic infections that are possibly or that can really affect them. So for the brain, I'm starting with the brain, of course. All right, please kindly stay tuned. Don't forget, subscribe to this YouTube channel, click on the notification bell so as to get updated on the next episode. So the brain, we have some things I want to talk about. One of them is one of the opportunistic infections that affects the brain is the cryptococcal meningitis. Now, what does this mean? The cryptococcal meningitis, it's a yeast-like fungus. Okay, it's an infection that usually involves the brain and the lungs actually. So although it can affect almost any organ of the body, all right, but those fungus affect the brain. Now the fungus can cause this condition and is found in soil. Okay, it can cause the cryptococcal meningitis, that's what I'm saying, and it's mostly found in the soil in the world. It's common in the soil all over the world. So the soil itself is contaminated by the birds, the droppings of the bird, or the droppings from the birds. So once the birds defecate into the soil, they can contaminate the soil with these organisms that can cause cryptococcal meningitis, that is the fungus or the fungi, right? So, and then this disease most often occur when a person's CD4 plus T cells count falls below 100 cells per cubic millimeter of the blood sample. All right. So that is that about the cryptococcal meningitis. The next one I'm going to talk about is the HIV-related encephalopathy. Now, this is a term for disease that alter brain function or structure. Okay, so and it leads to a problem with called cognitive function. All right, or mental processes, and then it also affects the memory. So in people with HIV and AIDS, encephalopathy is usually caused by an infectious agent, such as bacteria, it could be virus, or it can even be prion. So encephalopathy most often occurs when a person's CD4 plus T cells count falls below 50 cells, per cubic millimeter of the blood sample. All right. So that is that about the HIV-related encephalopathy, right? So it is a disease that alters the brain function. It affects the brain, the mental processes, and even the memory of that particular patient. So I'll also talk about, the next thing I'll talk about is the progressive multifocal leukoencephalopathy, and that is the PML. Now, this actually is a progressive multifocal leukoencephalopathy, and it is a rare disorder. Okay, so it's a rare disorder of the nervous system. It is caused by a common human papilloma virus, and also the JC virus also can cause it. So it leads to the destruction of the myelin sheet that covers the nerve cells. Okay, so the myelin sheet is actually the fatty covering that acts as an insulator or nerves fiber in the brain. So the symptoms include mental deterioration, and then vision loss. The person can have speech disturbances, and as well have inability to coordinate movements. Okay, then paralysis can also occur, and untimely coma too. So in rare cases, seizures might also occur when the person is affected with the PML. Okay, so and then this disease can occur when the CD40 cells of those patients falls below 200 cells per cubic millimeter of the blood sample. All right, so that is that about the PML. So the next thing I'll be talking about is the what I call the toxoplasmosis. Okay, the toxoplasmosis, of course it is condition that occurs when a parasite infects the brain. A parasite infects the brain. Okay, and then the symptoms include confusion or delusional behaviors. Then in severe cases there could be headache, and then fever or seizure, and also coma also can be associated with this. So it can affect the eyes actually, and then when it affects the eyes, it causes pains and reduction of vision. Okay, so and then this particular toxoplasmosis mostly it occurs when the CD4 plus T cells count of that person falls below 100 cells per cubic millimeter of the blood sample. Right, so that's where I'm going to stop for the brain. Now the next organ of the body I'm going to talk about is the eyes, and one of the opportunistic organisms that affect the eyes is called the cytomegalovirus, that is the CMV. Now, although this virus can affect the entire body too, it commonly affects the eyes, and it affects the retina, So when it affects the retina, it causes a blurry or blurred vision. Okay, and in severe cases, it can even lead to blindness. So and other symptoms of this CMV include there could be chronic diarrhea, and of course there could also be nerve problems. So it is a challenge that is mostly caused when the person's CD4 plus T cells falls below 100 cells per cubic millimeter of the blood. Okay, so that's when this particular person's gets affected with this CMV. Okay, so the next thing I'll be talking about is the gastrointestinal tract. Now, some of the opportunistic infections that affect the gastrointestinal tract includes the cryptosporidiosis, the cytomegalovirus too can affect it, but I'm going to talk about the cryptosporidiosis and Mycobacterium avium complex. Now, for this cryptosporidiosis, now this is actually a parasite that can cause chronic diarrhea, and other symptoms include stomach cramps. So you could be having stomach cramps, nausea or fatigue, and then weight loss too. Then the patient can lose appetite and can be vomiting and as well dehydrating. Okay, so and this infection is difficult to treat, of course, because there is no definitive effect treatment. So but the symptoms control and treatment of HIV is actually necessary in this case. Okay, so I will talk about the Mycobacterium avium complex too. So now this actually is a bacteria. It is a bacterial infection that causes persistent fever and then night sweat. It also causes fatigue, weight loss, anemia, abdominal pain, dizziness, diarrhea, and weakness. So the bacteria that actually causes this infection is found in the water, okay, and then also it's found in the dust. It can also be found in the soil that is being contaminated by birds dropping. Okay, so and then of course this disease happens to occur when the CD4 plus T cells of that patient falls below 50 cells per cubic millimeter of the blood sample. So preventive treatment is very, very important. However, the next thing I want to talk about here is the genitals. Okay, I want to talk about the genital area. What are the types of infection that can affect the genital area? So the number one thing I'll be talking about here is the candidiasis. Okay, so this candidiasis is actually an infection that is caused by the Candida fungi. So, and of course, it is also known as the yeast infection, as some people will call it. So, it's most common with it is an HIV-related fungus, or would I say it is mostly it's the most common HIV-related fungus, let me say it that way. So, and it can affect the entire body actually, but most commonly occur in the mouth. We call it thrush when it occurs in the mouth, and then it can occur on the vagina. So an overgrowth of the yeast in the vagina can actually cause irritation. It can cause itching, burning, and thick whitish discharge. Okay, so that is that about that. Now I'll also talk about the herpes simplex in this case. So it is an infection too caused by a virus. It is a genital viral infection, and this infection causes painful blisters in the genital area or what we call cold sore. So in severe conditions, the severe conditions are more common in the advanced stage of AIDS, when the AIDS has advanced. So you'd have the severe condition of this, where the person is totally uncomfortable due to pain. The person is losing balance, and of course, when there's severe pain, of course the whole body system is in trouble or in trauma. All right, so the next thing we're going to be talking about is the human papillomavirus, the HPV. Now, this condition is considered the most common sexually transmitted diseases, which is the STD. Now, in the United States, it can cause, or it is caused, of course, I just want to say that it is mostly considered as a sexually transmitted disease, especially in the United States. Okay, so it can cause warts on the anus, and then cervix, on the cervix too. It can cause pain, warts on the penis, on the, and also urethral challenges, vaginal warts, and vulva. So of course, and then so far studies have shown that certain type of HPV can contribute to the development of cervical and anal cancer. So individuals with HIV and AIDS are at increased risk for developing the precancerous and cancerous lesions, okay, in this case. All right, so I also talk about the next thing we'll be talking about is the liver. The liver is an important part of the human body system. Very, very important. So for the liver, I'll be talking about the liver disease. Okay, now liver disease is one of the leading cause of death among AIDS patients, especially liver disease caused by the hepatitis B and hepatitis C virus. So, of course, many drug use in the treatment of HIV and AIDS can cause liver disease or hepatitis, but then we have improved drug presently that patient can take, and they are so safe and fine. All right, so stay tuned on this channel, because certainly we are going to be talking about those drugs late in the future. So it is important that patients infected with hepatitis receive treatment and follow-up care. Very, very important. Okay, all right, so let's move to the next thing. We'll be talking about the lungs, the kind of opportunistic infection that actually affect the lungs. Okay, so I will be talking about the coccidioidomycosis or coccidioidomycosis. Now, this infection is caused by inhaling an infective fungus called the Coccidioides immentis. Now, this fungus is found mainly in contaminated soil too. Okay, and then especially it is commonly found in southwestern United States, Mexico, Central America, and part of South America too. So the lungs are most commonly affected by this infection. Okay, so and then in severe cases it can involve the kidneys. It can also involve the lymph system, the brain, and the spleen. So the symptoms include coughing, weight loss, and fatigue. So meningitis is a common complication when this particular case is left untreated. Okay, all right, so next I'll talk about the histoplasmosis. Now this actually is also involves the lung. Okay, and then although other organs of the body may be affected. Okay, so but this fungus causes condition that is mostly found in the southern part of the United States and then South America, and this is the histoplasmosis. So it is usually found in soil too, contaminated with bird droppings and once it's inhaled, it can cause these infections. So the signs and symptoms of this infection includes the high fever, weight loss, respiratory complaint, an enlarged liver, spleen or lymph node, and then you could have depressed production of white cells and red blood cells and the platelets from the bone marrow. And then it poses a life-threatening situation. Okay, so the person can have unstable blood pressure too when this challenges is found in the body. Then we'll talk about recurrent pneumonia. Okay, now people with AIDS are at risk for recurrent bacterial pneumonia. All right, so bacteria can infect the lungs, which may lead to problems ranging from a mild cough to severe pneumonia. So recurrent pneumonia is most likely to occur when the CD4 plus T cells count falls below 200 cells per cubic millimeter of the blood in that particular patient. Okay, all right, so the next thing we'll be talking about here is the TB, tuberculosis. Now, this is a serious issue and is often deadly. So it's a bacterial infection that primarily infects the lungs. Now, TB is transmitted when a person with active TB coughs or sneezes, thereby releasing microscopic particles into the air. So if inhaled, this particle may transmit the condition we are talking about. And once infected by TB, it's a challenge. So, but most people remain healthy and, develop only latent infections. So people with latent infections are neither sick nor infectious. However, they do have the potential to become sick and infectious with active TB. And this condition can occur at any CD4 plus T cells level, but especially when the CD4 plus T cells counts falls below 350 cells per cubic millimeter of blood sample, this condition can happen. All right, next slide, we will talk about the lymphatic system. So here I'll be talking about the non-Hodgkin lymphoma. Now, this is a disease condition that is, associated with tumor. Okay, so lymphoma is a disease in which tumor develop from white blood cells in the lymphatic system. Okay, so and then it is another common disease associated with AIDS. So that's just what I'll say about the non-Hodgkin's lymphoma. Okay, so you can visit other studies or do research on this case, or you see a doctor. Now I also talk about the mouth and throat. Now for the mouth and throat, what I'll be talking about here is the candidiasis. So like I said, it is it is a fungus, okay, that is actually associated with HIV. So it can affect the entire body, but most commonly occur in the mouth or the vagina. When it occurs in the mouth, we call it thrush. Now an overgrowth of this cyst can cause white patches on the gum in the mouth, and then also on the tongue or even lining of the mouth. So it can also cause pain, then difficulty in swallowing and loss of appetite. So candida in the esophagus too, it's what I mean is this, it can also cause candida in the esophagus, and then the trachea, the bronchi or lungs. So all of these are AIDS defining when this condition are found. Okay, so the next thing we will be talking about here is the skin. And for the skin, I will talk about just 3 things. Now, the first thing I'll be talking about is the herpes simplex. virus. Now, I said this virus causes cold sore or genital hips, which are painful blisters in the genital area. So chronic hips or chronic hips simplex, that is the HSV. It is the chronic hips simplex virus. So it can cause a severe mucocutaneous challenge, and they are commonly associated or found during the advanced stage of this AIDS, that is the acquired immunodeficiency syndrome stage. Okay, so next is the Shigells. Now these are caused by a reactivation of the chickenpox virus. So it may cause painful rash or blisters that follow the path of the nerves. All right. So the next is the Kaposi's sarcoma. Now for this Kaposi's sarcoma, it is an AIDS-related cancer challenge. So it can cause reddish purple lesions that usually appear on the skin, and they also can appear on the lymph nodes. They can appear on the mouth and also on the gastrointestinal tract, as well as the lungs. Okay, so I believe it is very, very interesting, and I know that you have actually gained a lot from today's teaching. If you like my video, kindly give it a thumbs up and subscribe to my YouTube channel. Then please turn on the notification bell so as to receive updates when the next episode is being released, because on this channel you will have a lot of teachings that's going to help you whether you're living with HIV or not. Okay, so you can as well visit this channel to explore various teachings, as well as resources on HIV and AIDS. For, of course, also for when you want, you can access latest information on how to keep yourself and those around you healthy. Whether you're living with HIV or not, you need to stay healthy. All right, so I will be stopping here, and as a result of this, I hope to see you next in my next episode, where I will be talking about great things. I will be talking about some challenges or the signs and symptoms of AIDS in both male and female, in male and then in female. So stay tuned and don't miss out. Click on the notification bell so as to get notified when next we've released or when next we are releasing another video, so that you would not be left out of any important update. All right, so thank you for watching. I'll see you in the next video. Do have a wonderful day, and bye.